Hello, doctors. I'm Dr. Yasmeen Haseeb, and I welcome you all to our 5 Minutes Guideline series. In our 5 Minutes Guideline series, today we are going to discuss about guideline number 43. This is the intrahepatic cholestasis of the pregnancy. The name has been changed from obstetrical cholestasis to the intrahepatic cholestasis of the pregnancy. This is the layout of the guideline, and we will be discussing each point, taking into account every point in detail. Introduction. The incidence in the UK is about 0.7%. However, in the Indian Asian or the Pakistani Asians, this is 1.2 to 1.5%. The presentation is a pruritus without any skin condition, but however, there is bile acid. Bile acid has been included in this new guideline. This is a generalized, usually itch, and however, it is more common at night and more common on the palms of the hands and sole of the feet. As you all know, this usually comes in the third trimester. The diagnosis is about to include the itching as well as the concentration of the bile acid, which is a random concentration, not fasting, which is about equal to or more than 19 micromoles per liter. Intrahepatic cholestasis of the pregnancy is suspected, then you have to take a structured history and examination to exclude other causes of the liver dysfunction. However, if you are in the doubt, you can always repeat the bile acid as well as LFTs if there is a persistent itch. This is a table where the terminology has been included. Gestational pruritus if there is itching and the bile acid concentration less than 19. Mild if itching and the concentration 19 to 39. Moderate itching of the skin and bile acid concentration 40 to 99. In the severe, the itching and the concentration of the bile acid equal to and more than 100 micromoles per liter. The new guideline says that consider discussing the care of the woman if there are very early onset of the intrahepatic cholestasis of the pregnancy or the atypical presentation. So this is a new thing. Postnatally, they said that you have to retrospectively confirm the diagnosis by doing the history as well as the liver function test as well as bile acid. That is, they should be done at least 4 weeks after the birth, and they should return back towards normal, both the symptoms as well as biochemistry. Then what are the fetal-maternal risks? Advise the woman that the predominant symptom is itching and it can interfere with her sleep due to the itch. Higher chances of developing the preeclampsia, which is 12.2 as compared to 3.4%, and gestational diabetes, which is 13.2 to 5.9%. So monitor the blood pressure, urine monitoring, and the GDM screening is very important. Discuss about the risk of early birth and increased chances of induction of labor. The fetal risk is usually associated with the stillbirth. If there is a singleton pregnancy, there is no other comorbidity, then the risk increases. Then the normal, if the bile acid concentration is more than 100. If the bile acid concentration is 19 to 39 and no other risk factor, risk is similar to the background. However, if it is moderate type and there is no other risk factor, the background risk is 0.8 to 8% till 38 to 39 weeks of the gestation. And if it is bile acid concentration more than 100 micromoles, the risk increases 3.4%. As we discussed, the risk of the early preterm birth as well as spontaneous birth and the NICU admissions, which is a neonatal intensive care unit admission for the baby, increases. Increased chances for the meconium stained liquor, and there is increased chances of the stillbirth if the pregnancy is a twin, as well as there are other comorbidities. How you monitor the mother as well as the fetus? So you have to do the LFTs, which is a liver function test, and the bile acid every week, then determine the frequency on the individual basis. For example, in case of mild, you can do weekly till the woman reaches to 38 weeks, and then you decide the timing of birth. In the moderate, you can do the weekly until she reaches 35 weeks. And in severe cases, usually you have to take a decision about the birth, and you have to decide how frequent you have to repeat the testing. Fetal ultrasound or the CTG does not predict or prevent the stillbirth. Intrahepatic cholestasis pregnancy is not associated with intrauterine growth restriction or the placental insufficiency. Please note it down. The drugs they have said that do not routinely offer dorsodioxycholic acid, And it is only the symptomatic treatment, which can be either emollients, antihistamines, and the vitamin K is considered only if there is a steatorrhea or the prolonged prothrombin time. The birth time is very important. In case of the mild, consider the option of delivering the mother at 40 weeks. In moderate, this at 30 to 39 weeks. And in severe, you can plan birth at 35 to 36 weeks. Mode is not affected by the intrahepatic cholestasis of the pregnancy. Continuous electronic fetal heart rate monitoring is must if the bile acid is more than 100. There is no risk of postpartum hemorrhage in cases of uncomplicated intrahepatic cholestasis of pregnancy. Contraception. Intrahepatic cholestasis of the pregnancy does not influence the choice of contraception or HRT, hormone replacement therapy. However, the woman who has got the previous cholestasis, which was secondary to combined oral contraceptive pill, you can give her the option about progesterone or the other non-hormonal methods. In the future pregnancy, the chances of the recurrence is 60 to 70%, and you have to include the LFTs in the bile acid in the booking investigations. In summary, please note down the name has been changed from obstetrical cholestasis to intrahepatic cholestasis of the pregnancy. Bile acid consultation has been included, hepatologist opinion has been included, stillbirth in the twins as well as comorbidities has been included, and the retrospective diagnosis is at 4 weeks rather than at 10 days postpartum. And please note down, there is no increased risk of postpartum hemorrhage in cases of uncomplicated intrahepatic cholestasis of the pregnancy. Hope this guideline will help you to read the guideline in detail. Please like my channel, subscribe to it, and share it with your friends.